I would say what I find really resonates well when I'm training healthcare professionals is being really honest about this, laying down, helping them even know what the size of the landscape is. So really simply, what's the opportunity? How many technologies are out there? What's the size of people downloading these? Just really basic knowledge from a quantity perspective. And then being really honest with them about the barriers to the adoption and helping them see that they're the key to unlocking the opportunity. So when you have a touch point with your patient, if you can recommend a trusted technology, your patient is 10 times more likely to then go on and use it and get the benefit from it. The question then is, how do you make that choice? And the biggest thing is make sure that you've used an assessor organisation, because if ever you're asked the question, why did you make that decision? Just answering because I've used it wouldn't stand up in court.
No.
You know, from a professional indemnity perspective, or because my mate told me about it.
Yeah.
You need a safe system. So, you know, we can, and the final point I would also really, there's so many points I could make, but the final point I'd also say is no technology is perfect in the same way that no drug is perfect. All drugs have side effects and contraindications. So do technologies. So you might have a technology which works really well for teenage girls, but you wouldn't necessarily want to be recommending it to older communities, and equally in reverse. Or you might have a technology that doesn't work for somebody with a hearing impairment. That's the side effect. But it's not about a technology doing everything for everybody. It's about finding a trusted technology that meets the needs of the person that's sat in front of me.
Oh, that's fantastic. And what about your Orcas app library? I can access that as a private person, right?
Yeah, so it's free to use for 7 days. So it's if you go to orcahealth.com and then you just click on the app library, you can sign up to search and filter. So the app library, say for example you type in a word like anxiety. So as primary care physicians, if you're working with GPs, they'll be seeing a lot of anxiety and depression come through the door. We know that it's a post-pandemic mental health needs, and so if you type in anxiety, you'll get lots of results. So globally there are about 5,000 technologies just for anxiety.
But do you have a filter so I can see what's
exactly.
I mean, also what's there in Denmark, because sometimes I can't find the app in my app store, of course.
That's exactly it. So it's all about filtering. So you can filter according to the person's age. So preteen, teen, adult, child. You can filter according to cost. So whether the person can afford to pay for this technology, or whether you need it to be entirely free, or they're okay with in-app purchases. You can filter according to country of origin. So all the countries are there. You can filter according to functions and features. So some people really enjoy social media, other people don't, etc. And what it means is that you go from a huge list to the right technologies which can be trusted.
And you said that you have assessed, was it 18,000 technologies?
Yes.
And how many apps is in your app library at the moment, ish?
So so our app library, we would have all of them.
Okay.
So in our library, and the reason we do that actually is because it's not just about you recommending a technology. This is the other thing. If your patient walks in and says, I'm using that app, and waves their phone at you, what do you say? You might want to check that it's safe. So you can then search for that technology and be able to confidently say, well, it's great that you're using a digital health app, but looking at that technology, it's not holding your data securely and it's no clinical evidence. So let's find you a better technology. And you can just help them on that journey, because it's really scary when you've not been trained in digital health and your patient walks in waving their phone at you saying, I've been using this app.
Yeah. And because the apps and the software can be really complex. So, and I guess that's also why doctors tend to recommend things that they have personal experience with.
Of course. course,
Yeah,
of course.
that makes sense.
Yeah.